Continue with your reporting now, looking at stories making headlines coming out of the African continent. Nigeria has introduced new restrictions which include a ban on mass gatherings as a precautionary measure. Africa's most populous nation has seen a steady decline in new COVID-19 cases in recent months. However, officials are worried that a surge in India, Brazil and Turkey may result in a third wave of the pandemic. Let's get more details. We're joined now by Nigerian journalist Jonathan Liam Gone, who joins us from out there. Now, Jonathan, of course, as I mentioned, a steady decline in the number, and of course there have been restrictions on travel ban. Why did Nigeria reintroduce these new measures?
Well, I mean, so if I will quote the Nigeria's Minister of Information, Alhaji Lai Mohammed, in offering clarification earlier this afternoon, he said what was very obvious to anyone who actually took time to really listen to the statement that was made, which was made by the Presidential Task Force, or the steering committee that was set up by Nigeria's presidency, which has metamorphosed from what was known as the Presidential Task Force. What happened is a clear case of, I would say, not understanding communication or not being clear by the government agency in communicating. When you look through the document itself or through all of the things that have been said, you will recall that Nigeria, like many countries across the world, took certain measures from about August of last year, stroke April. And Nigeria actually has not announced a discontinuation of all of these measures that are being listed now as new measures. In actual, they are not new measures. It is I would say, if I put it in a certain way, I'd say it is just re-emphasizing the fact that we have all of these measures. Take, for instance, the curfew that runs between 12 a.m. to 4 a.m. It has always been there. But in terms of enforcement, it has been very lax. In terms of places of worship, the rule is places of worship shouldn't exceed 50% of their capacity. It never stopped being enforced, but people have since stopped complying. Places like nightclubs, bars are supposed to still be closed. However, people since stopped complying. If you go to some of Nigeria's most major cities like Lagos, the nation's federal capital, Abuja, Port Harcourt, a couple of places, people carry on as if all of these measures have since been relaxed. But I think the wake-up call has turned out to be all of the images coming in from India, especially. And if you look, Nigeria, like maybe many African countries, they seem to be having a knee-jerk reaction. They seem to be responding to situations when they are being seen to be desperate elsewhere. So what you've just had is, because there is the end of the Ramadan, the Muslim holy month of fasting, is rounding off, and it is being speculated by many analysts that the government took time. The timing is such that they know that a lot of travels happen in this period, a lot of festivities happen in this period, and as a way of discouraging people, this statement was put out there, and it was being made to look like they are new measures, but in actual fact, they are not new measures.
But are there several preemptive measures that are being taken to mitigate the likely impact of the variants which are of concern? What is the Presidential Steering Committee saying?
Well, yes, I would say, quite frankly, in the earliest phase of it, in the start of the pandemic, or when the consciousness of the pandemic was at its peak, at about this time last year, there were measures in place and there was follow-through. At the moment, the measures are still in place, but the follow-through isn't very evident. Take, for instance, there used to be like daily briefings, even by what used to be the Presidential Task Force, now Steering Committee. The briefings have now drastically reduced. They now happen at when they deem fit. And this perhaps is also being made to happen maybe because the numbers have continued to drop. Say, for instance, the official figures show that in the last 5 days, there hasn't been any recorded deaths in Nigeria. daily. The infection rate is hovering just about in its 20s. So many people feel as if the pandemic has gone. However, one thing I will say that the presidential task force, now the steering committee, what they've been doing very well is guarding jealously all of the incoming flights into Nigeria. I've made a couple of trips myself in the last couple of months, and I tell you, you will not be let onto a plane if you haven't got your verified COVID test, and if you also haven't paid for your post-arrival COVID test, which is expected to happen in 7 days. And some people have had their passports suspended for 6 months because upon return to Nigeria, they didn't go to take their test 7 days after. So these are some of the measures that I think the focus has been about people coming into the country rather than activities in country.
Now, another appeal is being made to traditional religious and community leaders to take up more ownership and responsibility for risk communication and community engagement. Are we seeing here maybe some kind of impact, particularly on religious and traditional gatherings that is beginning to emerge, and some non-compliance in those areas?
I wish the answer to that were going to be an emphatic yes, but sad to say from my journalistic observations, no. Some of the places that throw caution to the wind in terms of compliance are some of these institutions or places where you have leaders in these institutions you have mentioned. In places of worship, like mosques around, people still pray standing side to side, side by side, toe to toe. In churches, some churches are compliant, but on the overall, I'd say a larger number, the compliance has continued to decline. Right now, beyond just the rhetorics, I do not see, there's nothing that is very open that you would say, yes, this traditional, for instance, if you want traditional leaders to be vanguards of championing these conversations, it's important to domicile, say, test centers in their communities. Access to testing is still not simple. Only, I would say, arguably, only the state of Lagos and probably the nation's federal capital has got some of the most advanced access. So there is testing, but access to testing itself is not something that is easy. It is expensive. On the average, it costs about $150 to take a private test for COVID. So all of this have continued to be barriers and then when people even contract, because Nigeria, just like most African countries, is a subsistence environment where people live on a daily basis. If people don't go out to, the famous word used around is to hustle, to try to earn a living for that day, then they will be hungry. So all of this have just made the situation to be some sort of contraption that makes it very hard to enforce any government messaging that is being put out. So
you're saying even though the authority of ECHO, head of state and government, has fixed the price for testing at $50 US, there are some who are still charging above that?
No, so in Nigerian Naira, testing is the equivalent of about 51,000 Naira in the network, because they've got a network of labs. And by the time you convert that, it runs between about $120 to $130. And some places the testing is higher. So I would tell, I've done that test severally. I did one just a couple of days ago. It is way above the equivalent of $50.
Now, with vaccine nationalism compounding throughout the world, is Nigeria exploring alternatives of getting Nigerians vaccinated?
We actually have had various conversations. There have been 2 or 3 research centers across Nigeria that have said they were working on vaccines, but this has been several months. The last we heard any of those statements was last year. It just looks to me from observation that once Western nations started announcing the conclusion or the discovery of vaccines, the same whole lot of things just went straight into slow-mo because we haven't had anything about that. In fact, not even conversations about even this advancement from where they stopped has happened. So, no.
Jonathan, appreciate your time. Thank you very much for joining us tonight. Nigerian journalist Jonathan Liam Gone there, giving us the latest update on the COVID-19 developments in that country. An update of what's making news on the newsfeed late night when we continue next.